The canine endocrine system is a complex network of glands that produce hormones to regulate essential bodily functions, including metabolism, growth, reproduction, and stress responses. Key glands include the pituitary gland, often referred to as the master gland, which controls other endocrine glands and releases hormones like growth hormones. The thyroid gland regulates metabolism through the production of thyroxine, while the parathyroid glands help maintain calcium balance. The adrenal glands produce cortisol and adrenaline, which are crucial for stress response and energy regulation. The pancreas plays a dual role, producing insulin and glucagon to control blood sugar levels. The reproductive glands, ovaries in females and testes in males, secrete sex hormones that influence development and reproductive functions. This intricate system works through a delicate balance of hormone release and feedback mechanisms, ensuring that the body maintains homeostasis. Hypothyroidism is a disorder caused by an underactive thyroid gland that does not produce enough thyroid hormones. The thyroid gland is located in the neck near the larynx and just in front of the trachea. Hypothyroidism is one of the most common endocrine disorders in dogs. It is most commonly caused by an autoimmune disease, where the immune system attacks the thyroid, or it can be caused by thyroid gland atrophy or a tumour. Hypothyroidism is not contagious or zoonotic. It develops due to a failure of the thyroid gland to produce adequate levels of hormones. It is commonly seen in middle-aged to older dogs, and certain breeds are predisposed, such as golden retrievers and cocker spaniels. It can also be caused by thyroid gland destruction due to other factors, such as cancer or radiation therapy. Symptoms include lethargy, weight gain, cold intolerance, thinning or dull coat, hair loss, skin infections, slow heart rate, and changes in the dog's behaviour, such as increased irritability or depression. In severe cases, it can lead to seizures or a coma, though these are rare. If untreated, hypothyroidism can lead to cardiovascular problems, neurological issues, and a weakened immune system, increasing the risk of secondary infections. In severe cases, it can result in a coma, a life-threatening condition where the dog goes into shock due to extreme hormone deficiency. Treatment typically involves lifetime thyroid hormone replacement, usually in the form of synthetic tablets. Treatment helps to manage symptoms and improve the dog's quality of life. Regular vet checkups are essential to monitor hormone levels and adjust medication doses as needed. In a salon, dogs with hypothyroidism should be handled gently, as they may have dry or thin skin and their energy levels may be lower. Grooming should avoid excessive stress or prolonged physical exertion. Prevention of hypothyroidism is not possible, as it is often genetic or idiopathic with no known cause. However, regular vet checkups can help catch the disease early and start treatment before complications arise. There are no known preventative measures for autoimmune thyroiditis. Cushing's disease is, as the name suggests, a disease and is typically caused by the overproduction of cortisol, a hormone produced by the adrenal glands. This can happen due to either a tumour in the pituitary gland or a tumour in the adrenal glands. Cushing's disease does not spread between animals. It develops over time due to either a benign tumour in the pituitary gland, which causes a release of too much hormone, or an adrenal gland tumour that directly overproduces cortisol. It most commonly occurs in middle-aged to older dogs, and some breeds are more predisposed. Another cause could be as a result of high doses of steroid medication. Symptoms include excessive thirst, increased urination, increased appetite, panting, lethargy, muscle weakness, hair loss, and a pot-bellied appearance. Some dogs may also develop skin issues such as thinning skin, bruising, and slow healing wounds. Cushing's disease can lead to complications like high blood pressure, diabetes, kidney disease, and increased susceptibility to infections. If left untreated, it can significantly impact the dog's quality of life and lead to serious complications, including an increased risk of blood clots and organ damage. Treatment typically involves medication to control cortisol production or surgery to remove a tumour if one is present. In some cases, radiation therapy is used to treat pituitary tumours. At home, managing the disease requires regular vet checkups and blood tests to monitor hormone levels. In a salon, it's important to be gentle with affected dogs, as their skin is often fragile and they may have less energy than usual. There is no known way to prevent Cushing's disease, as it is often caused by spontaneous tumour growth or is related to ageing. Regular vet checkups, especially in older dogs, can help catch the disease early and begin management. Addison's disease, also known as hypoadrenocorticism, is a disorder of the adrenal glands whereby the glands aren't functioning correctly and are failing to produce sufficient hormones, the opposite of Cushing's disease. It develops when the adrenal glands fail to produce enough cortisol and aldosterone, which are essential for regulating metabolism, stress responses, and electrolyte balance. The exact cause is often unknown, but it is believed to be autoimmune in nature, and genetic factors may play a role in some breeds. It is thought that some cases could be caused by trauma or tumours of the pituitary gland. Symptoms include lethargy, vomiting, diarrhea, weight loss, excessive thirst or urination, and a poor appetite. Some dogs may experience episodes of severe crisis, which can include shock, collapse, and low blood pressure. Shock is life-threatening and must be treated immediately with emergency first aid and vet treatment. Addison's disease can be life-threatening, especially if the dog goes into an Addisonian crisis, acute adrenal insufficiency, which requires immediate medical attention. Chronic management is necessary to prevent life-threatening complications such as dehydration, shock, and electrolyte imbalances. Treatment typically involves hormone replacement therapy, as well as monitoring for signs of crisis. In a salon, affected dogs should be treated gently, as stress or overexertion could trigger a crisis. Regular vet visits are necessary to adjust medication dosages and monitor the dog's condition. There is no known way to prevent Addison's disease, as it is largely genetic and autoimmune in nature. Early diagnosis and management can help improve the dog's quality of life and prevent crisis episodes. An Addisonian crisis is a life-threatening emergency that occurs when a dog with Addison's disease experiences a sudden, severe imbalance in electrolytes or hormone levels. It's often triggered by stress, illness, insufficient cortisol and aldosterone production by the adrenal glands, or a lack of medication if a dog has recently been diagnosed or a dose of medication has been missed. Signs and symptoms include vomiting and diarrhea, weakness and lethargy, collapse, shock, low blood pressure, dehydration, severe weakness and tremors. Immediate veterinary care is crucial. Have the owners of dogs with Addison stay nearby so they can administer fluids and electrolytes to stabilize the dog in the event of a crisis. Hormone replacement therapy to support the adrenal glands is required by a vet. Prevention includes regular medication as prescribed by the vet, stress management and a calm environment, frequent checkups to monitor the health and electrolyte levels as well. Handling and adapting to a dog with Addison's disease requires extra care and attention during grooming, as this condition affects the adrenal glands, leading to a lack of crucial hormones like cortisol. Here are some steps a groomer should take. Understand the dog's condition. Before grooming, ensure the dog's condition is stable. Addison's disease can cause symptoms like weakness, vomiting, diarrhea or lethargy, especially during times of stress. Check for any signs of illness or distress before beginning the grooming session. Minimize the dog's stress throughout the grooming session. Dogs with Addison's can be more sensitive to stress, so it's important to keep the environment calm and quiet. Avoid loud noises, sudden movements, or rapid changes in temperature. Maybe even book the dog on a one-on-one basis. Take breaks if the dog seems anxious or tired. Gentle handling is key. Avoid putting too much pressure on the dog during grooming, especially around sensitive areas. Monitor the dog's health throughout. Watch for signs that the dog might be experiencing an Addisonian crisis, which can include vomiting, lethargy, weakness or tremors. If these signs occur during grooming, it's important to stop the session and inform the dog's owner immediately. Work in short sessions. If the dog becomes stressed easily, break the grooming into shorter sessions. Focus on one area at a time, such as brushing the coat or trimming the nails, and take frequent breaks to avoid overwhelming the dog. Communicate with the owner. Make sure to ask the owner if the dog is on any specific medications or if there are any special instructions for handling the dog due to its condition. The owner might provide advice about their dog's medication or special care needs during grooming. Hydration. Dogs with Addison's disease can sometimes become dehydrated, so ensure fresh water is available during the grooming session. Dehydration can exacerbate symptoms, so keeping the dog well hydrated is important. Avoid overheating. Since Addison's disease can affect the dog's ability to regulate body temperature, be cautious of overheating. Ensure the grooming area is cool and well ventilated, especially if you are using heated tools. Post-grooming care. After the grooming session, check in with the owner to ensure the dog is doing okay. Some dogs may need rest following a grooming session, especially if it was a longer or more intense session. By maintaining a calm, patient and informed approach, groomers can help ensure the safety and comfort with dogs with Addison's disease while providing the grooming services they need. Addison's disease is a disorder of which glands? The answer is the adrenal glands.